Hi, I'm Dr. Gary Nye. I'm one of the owners here at Angel Animal Hospital, and I run a service called Integrative Veterinary Services of Missouri. And today we're going to talk about cancer in dogs.
Okay, Dr. Nye, what are the most common types of cancer in dogs that you see in the clinic?
Well, we see a whole range of different cancers, but the most common ones certainly are lymphoma and mast cell tumors. We see all types, but those are the two most common, most frequent tumors or cancer types that we see. And then, they can show up in a variety of different places in the body. And so, types of cancer in the body, whether it's a splenic or liver mass or in the skin or lymph nodes or whatever, that's wide and varied as to where those cancers will show up. But mast cell and lymphoma are definitely the most common we see.
And what causes cancer in dogs?
Well, cancer in dogs and any species is an immune related problem. The conventional side of medicine and veterinary medicine will talk about it being a genetic problem, and they chase a lot of DNA reasons for the cancer getting started in the body. But it really takes beyond genetics. Sure, you can be predisposed to cancer with genetics, but you have what's called epigenetic or environmental conditions that cause genes to be turned on or not. And so if you don't have the right environmental conditions, that cancer may never get started in the body and be allowed to exist. But in the end, it comes down to the immune system did not do its job to prevent those abnormal cells from growing on to become a cancerous mass in the body. And the immune system itself has many, many, many support mechanisms that have to be functioning appropriately in the body for it to work well. And so I always like to say that how an individual got to a cancerous mass being in the body has dysfunction before that and led to immune system not working right, and how that pathway of dysfunction is as unique as fingerprints on a human, basically, because there are just countless ways where you could have some deficiency or dysfunction or multiples that led to that immune system not working right and killing those early abnormal cells that eventually become that cancerous mass. And we all have abnormal cells that develop in our body every day. And if they get past the immune system and it doesn't do its job, then we end up with potentially a cancerous mass growing later.
What are the signs of cancer in dogs?
Again, the signs are varied. They vary widely, but in general, I think you can say that if you have an early cancer, they may not show any signs at all, other than maybe detection of a swelling in a lymph node, or if they come in for a physical exam and we detect a mass in the abdomen or something like that, and they may not be showing any signs, but as it progresses, it's going to have generally, there's going to be pain, inflammation associated with it. Dogs are very good about hiding that. And so they may not show it well until it gets very bad. So they're generally, mid or late stage by then. But they can also have other things that will start to show in their everyday behavior, such as loss of appetite or decreased appetite, maybe weight loss. They might have individual symptoms related to the organ system that the cancer is associated with, like the liver. We may see elevated liver enzymes on a blood test, or if it's in the urinary tract, we may see blood in the urine or difficulty urinating or something like that. Nerve tumors will tend to cause neurologic deficits, and we may pick it up as a gait abnormality to start with, or some neurologic deficit. So again, the signs are very wide and varied in any individual with cancer.
What will a veterinarian do to diagnose my dog with cancer?
There's a lot of different ways to diagnose cancer. Some of them are going to be less specific than others. On the conventional side, they're usually going to do a physical exam, maybe take some radiographs, maybe do an ultrasound. If you go to a referral center, they may do something more advanced, MRI, CT, and so things like that for imaging. On my natural service, we'll tend to do obviously the physical exam, radiographs, and the ultrasound is all available to us here in the clinic. And then I use a number of different ways of diagnosing cancer in a patient, or at least getting a good idea that there is a cancer present. There's some blood tests that I use that are very good for markers of cancer. In fact, two different types of blood tests. One of them right now is very specific for lymphoma in dogs, and the other one is more of a generalized any type of cancer. We'll see that marker go up in patients. And then there are things like biofeedback, frequency biofeedback that I use in my patients that can give me a good idea that there are conditions in the body that may allow a cancer to exist. And we use that then as part of the treatment.
What questions should I ask my veterinarian after my dog is diagnosed with cancer?
I think one of the first questions I would ask any veterinarian or even a physician on the human side, if I was going in with a diagnosis for myself, would be, what are you going to do to help my immune system or my dog's immune system fight this cancer? And if they can't give you a good answer to that question, I would not use them to treat that cancer. Most of the conventional approaches to cancer deal with either a chemotherapeutic of some sort or radiation and possibly a combination with surgery. But for the most part, the immune system is totally ignored. And no matter how good the treatment is at killing the cancer cells, if you don't build that immune system and get it to function right, the condition still exists for why that cancer was there in the first place. And the body cannot participate well in eliminating any leftover cells that that treatment may not have gotten.
If my dog has cancer, will they need to see a specialist?
I say yes. There are certainly, individuals that treat cancer that aren't necessarily specialists. I consider myself a specialist on the natural side or integrative medicine. And so, from my perspective, I would recommend that owners come to someone like me to get the best approach at treating a cancer. Now, if you're on the conventional side, and you're going chemotherapeutic and radiation route, you're going to have to seek out oncology support for that in most cases at a referral center or a university setting. But there are private practices out there where we have integrative medicine specialists like myself that deal primarily in natural medicine, and we can address cancer and the whole body health, and especially getting that immune system working well so that it will participate in killing that cancer.
What does a cancer diagnosis mean for my dog?
It really depends upon the stage the cancer's in, when we detect it. In other words, the type of cancer and where it's located at. Some cancers, by the time we detect them, they're generally going to be very late mid stage or end stage in the progression of that cancer. And it generally has a very poor prognosis no matter what route you go for treatment. Quality of life and comfort and so on is very important in those patients, and that's something that a whole body approach certainly can achieve from the natural side. Uh, if we detect the cancer early, then the prognosis can be much better, and that it doesn't necessarily mean that it is a terminal disease. And that's certainly, I always strive to detect it as early as possible, backing up even before the diagnosis. I'm trying to have my patients well positioned to prevent that cancer from ever getting started. But the stage and type of cancer where it's located are certainly going to influence what it means for an individual dog.
What is the prognosis for dogs with different types of cancer?
Yeah, again, it depends upon stage and type of cancer and where it's located. If you get a lymphoma, for instance, and we detect it very early, then generally those dogs will do very well for a long period of time. And especially if we're building up that body and that immune system, and while we're trying to treat and attack that cancer. support the dog nutritionally so that we get a better plane of nutrition and don't feed that cancer. We actually starve that cancer by eliminating some of the things that the cancer will feed off of. So, it depends upon, again, what stage you get and where it's located. In some cases with lymphoma, for instance, it may be a lymph node only type cancer and not in the internal organs. So in that case, you can have a very good prognosis for many years.
What should I do if I notice any new bumps or lumps on my dog?
Yeah, if you notice anything new, the best thing would be to have it examined by a veterinarian and see if they think that it's worth going on for any diagnostics. And especially external lumps and bumps in the skin or on the skin are more easy to diagnose nowadays than they used to be. We have a new system in the hospital that we've been using for almost a year now that can scan lumps and bumps on the body and give us a very high degree of confidence as to whether it is a malignant or non-malignant mass. Now, benign masses that are non-malignant can still be a problem, but it's not at least likely to metastasize elsewhere in the body. So, the best thing is get it checked out early, and even if it's benign, you always want to be watching for any rapid growth, any change in character of that mass, and size measurement and so on. So when we examine it, we'll do a size measurement, record that in the record so that we can assess it over time and see if there's any kind of a change. If we do get an indication of malignancy on that simple scan that's non-invasive, then we'll generally recommend what we call a fine needle aspirate, where we will suck a few cells out of the mass, put them on a slide, stain them, and evaluate them to see if they look like they have characteristics of malignancy or a cancer in general. So yes, if something comes up that's new and you haven't seen it before, best thing to do would be to get it checked out. Because like I said earlier, the earlier that we detect it, the better the ultimate prognosis is going to be. And we can do a lot of things for cancers, especially when we detect them early, and quality of life is still good before things start going downhill. I hope that helped a little bit on that part of the discussion. We'll do another video on treatment of cancer to follow this up. But if you have something you'd like us to check out and talk about cancer treatment in your pet, give us a call here at Angel Animal Hospital, or contact us through our website, and we'll go ahead and put that information up on the screen for you so that you have it and can reach out to us.